As coronavirus cases continue to spike across the country, developing treatments and developing a vaccine remains a top priority. Now, scientists say that the antibodies that remain in people who have recovered from this virus may be critical in learning how to defeat it, but time is of the essence. A new Chinese study out this week showed that those antibodies faded away after just 2 months in more than 90% of the participants. So there's a really short window to take advantage of this, and it became especially significant to one man who contracted the coronavirus and then recovered. And what he really wanted to do was help other people and help them by donating his blood. He recovered and he wanted to help those other people. So I spoke to him. His name is Yuval David, about the moment that he found out that his blood, in fact, was not welcome because of his sexuality.
Go up at the blood bank and you hear what?
There wasn't a box for me to check. You know, we're talking about the census now, right? Making sure that during the census that everybody is counted for. The questionnaires, the computer system, and the staff who I encountered were still only educated for the policies, the policies that were there since 2014 and 2015. In April, the policy changed. The policies of the FDA and the AABB, which is the American Association of Blood Banks, changed to say, okay, we're now going to let gay and bi men and trans women and women who have sex with men who have sex with men, we're going to change this policy to allow them to donate blood if and only if they have abstained from sex for 3 months. So all of a sudden, my Facebook and social media was filling up with messages from other advocates and activists saying, hooray, the policy's changed. And then I said, wait a second, people, look at the fine print. My blood is still not accepted, even though I'm a married man, even though I do routine physicals and I don't do drugs and I'm super into health and nutrition and fitness and I have all of my medical records, but my blood is discriminated against. I'm being discriminated against for what's inside of my body.
And so as it stood, when you went to go get blood, what you learn is that you can't donate unless you haven't had sex in 3 months, even though you're a healthy married man. And this is not a question that they ask heterosexual men.
It's not a question that they ask heterosexual men, but when they have the information that I'm a homosexual man, that I'm a gay man, that's basically when it stops. Mm-hmm. First of all, how can I even prove that I've abstained from sex for 3 months? That's question number one. So I could lie. And I said to the woman who was there, the intake staff person, and her eyes actually teared up. Okay, I wasn't going to argue with her. She was doing her job. And in a hushed tone, she apologized to me. She said, I'm sorry, I can't do anything other than what's in the system.
So I spoke to Yuval at length about the discrimination that he felt there at the blood bank and how significant that moment was for him. You can listen to the rest of that interview at cbsnews.com. It is truly, truly fascinating. But, you know, like we pointed out, Vlad, this is a question that straight people are not asked at all. When was the last time you had sex? He's been married for a number of years. He's a very, very healthy person, health-conscious person, and he was flabbergasted.
It just, once again, is just another reflection of the inequality that exists in this country for many, many people. And it even is reflected in the midst of a pandemic when somebody is clearly trying to do some good. And this is what the result of that is. And, you know, Anne-Marie, as you know, this ban isn't just affecting homosexual men, of course. The FDA put the 3-month limit on transgender women, as well as women who have sex with bisexual men. So here to talk more about the donation ban and how it's affecting not just the LGBTQ community, but all Americans is Rich Ferraro. Rich is the Chief Communications Officer for GLAAD. Rich, thank you so much for being with us. You just heard the interview that Anne-Marie did there. The blood ban for these groups originally required a 1-year abstinence period, but in March, due to the coronavirus, that was shortened to 3 months. I mean, what did that move? Explain. Why did they do that?
Sure. Why did they do that? Thanks for having me today and for speaking about this issue, because the more we speak about it, the better chance we have to end this discriminatory policy. So when the Surgeon General stood on the White House stage during a coronavirus briefing at the end of March, he made an urgent call for blood donations, that the country needed them. And I'm glad the advocates on our staff and many LGBTQ advocates around the country said, well, we'd be willing to give blood, but we can't because of the 1-year deferral period at that time. So what we did was we organized what the LGBTQ community does best. We organized on social media. There was a GLAAD petition that went out calling for an end to the deferral time. We also issued a letter from now over 600 doctors have signed this letter, letting the FDA know that this deferral time is outdated and unnecessary. They did reduce the ban from 12 months to a 3-month deferral time, but that still is not rooted in science. It's rooted in stigma, and it needs to change.
Well, we pointed out that this sort of initial ban of 1 year was put in place in the 80s, and this was during the AIDS epidemic. But much has changed even about HIV/AIDS. Yes, they altered things because we're dealing with a pandemic now, and we need sort of all the help we can get. But even when it comes to HIV/AIDS, it's not what it was in the 80s. The infection rates are not
Correct.
what they were in the 80s. Is it time to sort of overall, not just because of the coronavirus, but in general, take a second look at these guidelines, and not only the way that they're harming the LGBTQ community by being discriminatory, but harming all the rest of us, because giving blood is about helping everyone.
Right. And the Williams Institute out of UCLA did a study that estimated that over 300,000 men who have sex with men, gay men, bi men, would donate blood, and that could save more than 1 million lives. And the ban actually in the 80s when it was enacted was a lifetime ban. And then around 5 years ago, it was reduced to a 12-month deferral period. Now we have a 3-month deferral period. And next up is no deferral period. And that's because all blood is screened to make sure that that blood is healthy. In addition to GLAAD and LGBTQ speaking out after the 3-month deferral period and calling for an end to a deferral period for men who have sex with men, the American Medical Association spoke out, and they said in their statement, we urge the FDA to remove the categorical restrictions for blood donations by gay and bi men, so they are instead based on a person's individual risk. That's what should be screened for as you're donating blood, your individual risk, not whether or not you're gay or bi, especially at this time when blood donations and plasma donations from COVID-19 survivors are so necessary. It's important that all of the blood that is healthy, that is possible out there, is collected and given to the people who need it. We also wanted to point out that in other countries, Brazil being one of them, they've ended this deferral period as well.
Wow. So we were just listening to Anne-Marie's interview with Yuval, who is married. Today marks 5 years since the Supreme Court ruled that the protections allowed of all couples extends to gay couples. And I remember myself, I specifically remember that day, Anne-Marie, it was in the afternoon, and I was actually co-anchoring with David Begnaud, our colleague, and he was filling in. And it was one of those rare moments where we sort of high-fived each other on the air as the ruling came down, because it was such a momentous occasion, likened to many other civil rights moments in this country. And since then, of course, hundreds of thousands of people from the LGBTQ community have legally tied the knot. Since married heterosexuals are not questioned about their sexual activity before donating blood, does there still exist this double standard? And what does this FDA parameter say about marriage equality in this country, even though it has been ruled by the Supreme Court to be legal?
Yes, the blood donation deferral time is yet another reminder that LGBTQ people still are not legal, despite the historic case 5 years ago. I remember celebrating that night in Stonewall Bar, which right now is going through really tough financial times because of COVID-19. So I want to urge everyone to support the Stonewall Bar. But in addition to celebrating marriage equality, I think today we have to remember all of the injustice that still faces LGBTQ people. Of course, we're talking about the deferral time on the blood donation ban. Last week, the Supreme Court had a historic announcement that LGBTQ people cannot be fired just for being LGBTQ. But it's 2020 and we're still debating whether or not you can fire someone for being LGBTQ. Our dignity is up for debate, it seems, every year before the Supreme Court. And I believe all of us deserve to live in a country where we can be safe and protected and equal. And that is happening for the LGBTQ community, but we still have a far ways to go. This Pride Month, we're also remembering that Black Lives Matter is an LGBTQ issue, because there are Black LGBTQ issues, and that Black trans lives matter, and that the epidemic of violence facing Black trans women and trans women of color needs to be addressed and needs to be ended. So we have a really far way to go when it comes to LGBTQ equality. And today, as we remember what it felt like 5 years ago, to finally have that recognition that we can marry the person that we love, just like others in this country, I want everyone to remember that we still have a long way to go. That's why groups like GLAAD are still pushing every day to fight for equality and for a country where LGBTQ people can live free and equal.
It's appropriate that you would talk about, the focus for this year's Pride, 'cause Pride Day is tomorrow. This entire month has been Pride Month. Normally, it is a time that strikes this perfect balance of celebration, but also activism. But it's in the time of COVID-19, and people need to be safe. So, what can people do to mark Pride Day and make sure that they stay healthy and safe with their friends and family?
Yeah, I always say working at GLAAD, it seems like every day of my life is a gay pride parade. But this month, yes, it's Pride Month. And what's amazing is we're seeing so many allies speak out for the community. And it's a time when we were going into Pride Month at GLAAD, we were really concerned because of COVID-19. COVID-19 canceled over 300 Pride events around the world, canceled or brought them virtual. And especially for LGBTQ people who might be living in homes that are not affirming, where they're not accepted, Pride is that time where the sense of community and the spirit of togetherness is front and center. So going to the large Pride March down Fifth Avenue here in New York, or any of the amazing events put on by New York City Pride, is really key to New Yorkers here. And in cities around the country, those Pride festivals are key to get that community spirit going. So instead of the in-person events, or in lieu of them, what we've done at GLAAD is created a Pride guide, glaad.org/pride, where it lists over 100 virtual events. Later today, folks can tune into the GLAAD Facebook channel at 1 p.m., where we're working with a group called Pride Live to put on Stonewall Day. Stonewall Day remembers where Pride began, and Pride began as a protest. So another thing to do this month is to protest in safe ways, along with those activists in the racial justice space. But Stonewall Day today at 1 p.m., we're going to be featuring messages from President Obama, from Taylor Swift, from Demi Lovato, from some amazing LGBTQ artists like Shia Diamond and trans model Gina Rosero. And those messages we're hoping reach far and wide. So while we can't be together in person, what I'm hopeful for is that these virtual events will reach people who may not have been able to make it to New York City for Pride, but now they can tune in and see all of these notables saying you're accepted just for you are, and to hold your head up high and be proud.
Love the way that you ended that for us, Rich. Thank you so much. Happy Pride. We really appreciate it.
Yes. Thank you both so much.